Hi everybody. Um, this is my third update on my plasmapheresis. So far, I have had nine procedures done, and I'm already seeing improvements. Um, I'm able to move my right leg a little bit. I have a tiny bit of swallowing come back, but today it was a little discouraging because it it regressed back to where it was again, and I don't know, but maybe the treatment I have on Monday will help it get back to the point it was when it was healing. Um, I'm getting some sensation back in my right hand, and here's something cool. I haven't felt anything warm or hot. I lost my sensation of temperatures when I got Guillain-Barré syndrome and was paralyzed, and I haven't been able to feel anything hot since 2005 when I was 15. And a few days ago, for the very first time in nearly 6 years, I felt warmth. And although I was so glad to be able to feel something warm, it hurt so bad because I don't know. It wasn't even hot. It was just warm water. But I haven't felt it in six. I haven't felt anything warm or hot in nearly 6 years. So it hurt really bad. My body just perceived it as pain. So that's a good thing. Some of my temperature sensations are coming back. The paralysis is a slow progress, but it's doing okay. Um, Feeling the way I'm feeling, I am just feeling extremely fatigued, really nauseous, and I can't think. You know, when you have nearly 3 liters of plasma removed from your body, you just can't think. It's like beyond brain fog. Um, I'll just go into a blank stare and literally be thinking nothing, just staring off into a distance. And my I'm kind of doing it now, but it's not as long. My family members will have to like kind of push me on the shoulder and say, "Snap out of it." Um, so my feeding tube is going okay. I'm still not tolerating it, but I have no choice but to run it at 50, or here's my choices. I can keep not tolerating it and not doing well, and it can have it keep making me sick, or I can go back in the hospital and get TPN and stay there until I tolerate my feeding tube. Weigh the odds. I don't want infections, especially since I have 2 lines, one here and a PICC line. Here, I'll show you my PICC line. So, I don't want to risk an infection, but that's where I'm at right now. And speaking of lines, this is finally, oh thank God, finally, it's going to be changed into a TVC line, which is a tunnel vascular catheter line, on the 13th, June the 13th. So basically what they're going to do is they're going to take this, okay, there, that's better. They're going to take this, and they're going to basically remove the 2 lumens, put a wire down here, and they're going to tunnel it just like I had my last one. See where the scar is? You can see the scar there. But they're going to tunnel it just right about there. So I'll have this coming out here sorry, I'm confused with my camera. And I'm not editing. Remember, I told you I'm not going to edit. So it's going to be coming out here, and instead of 2 lumens, these are called lumens. Instead of having 2 lumens for pheresis or dialysis, I'm going to have 3 lumens. And that's really good, because if I have 3 lumens, that means I can remove my PICC line. And that's less chance of infection. And so the reason why they're going to do 3 lumens is so while I'm having plasmapheresis, blood comes back to me through the red one, and blood leaves through the blue one. And I'm going to have a white lumen, that's the third, and what that's going to do is enable them to give me D3 saline and medications while I'm going through the procedure. So surgery for that is on the 13th of June, 7 a.m. Oh, and I actually have a line here I'm going to show you that they use for it. Okay. So, this is a tunneled vascular catheter. And it's the same size as the one I have in my neck right now, except 4 inches have been cut off of this so they could test it for an infection. And as you can see, it's split. I don't know if you can see it very well. It's split in 2. So that it's because it has 2 lumens. It goes right here and goes into my heart. And this comes out. And then what I have in my neck right now is a form of this. This is what I had on my right side, except this cannot be converted into a tunneled vascular catheter line. And so that's why I have this. This is the same size as this. It's a 14 French, and it's wider than a pencil. I kid you not. Let me see. I don't have a pencil around me, but it's really big. It's just huge. So, and last but not least, I have a PICC line. You guys probably think I'm crazy or something. What is she collecting? No, the people in IR know I have this channel for educational purposes, and they let me keep my lines. This is a PICC line. Again, it's not as long because they cut the tip off to test it for infection, but this is a PICC line. And this is the plate. And this blue thing is called a bio patch. You can actually see one here. It keeps all infections out. The plate holds it in place so it can't go anywhere. I mean, it's the stickiest thing on earth. And this also has 2 lumens, and when it says CT on it, that means it's contrast injectable. So if you're going to have an MRI or a CAT scan, they can inject contrast through this. Some they can't inject contrast through, but if it says CT, then they can inject contrast. Here is the clamp. And yeah, so that's what I have, and I'm keeping netting over this for this PICC line because my niece, my 1-year-old niece, is visiting, and you know how babies are. They pull on everything, and yeah, I have family visiting from Wisconsin, so I keep everything contained. Usually it's very uncomfortable, but I keep this stuffed in my shirt while I'm holding her, so she has nothing to pull on. But this hurts because my stitches, so I like to keep it there or here. It's most comfortable there. So I'm out of breath now telling you guys everything. But things have been working out, and I do have some news. I'm going to be starting maintenance therapy. So I will be having plasmapheresis um, 3 times a week for 1 to 2 weeks, then 2 times a week for 1 to 2 weeks, then once a week forever, or until it stops working. And right now it's working very well. That's why we decided to do maintenance therapy. Um, Sometimes after people get Guillain-Barré syndrome, they have to do plasmapheresis. Sometimes twice a week, once a month, once every 3 months. It's called maintenance therapy because their paralysis symptoms come back. And that's what I'm going to have to start doing to keep paralysis away. I'm going to do um, maintenance therapy, which is plasmapheresis, apheresis, plasma exchange, whatever you want to call it, um, for once a week for a very long time to ward off that paralysis. And I just pray to God that it works, and it's working now. So, and my blood pressures, they've been doing okay. I have been doing a lot of passing out. So, I haven't been taking my beta blocker. Dr. Barboy put me on Zebeta, and my heart rate is so fast. I want to take the beta blocker, but right now I can't because my blood pressure is too low. And so that's where I'm at right now. So, not much else to update you guys on. Um, but I really, I hope this is educational for somebody else. Um, if they're gonna get plasmapheresis or if they have family members that get plasmapheresis. So I'm hoping this helps and it brings awareness. So I love you all. And if it is helping you, if you are somebody who is getting plasmapheresis or knows somebody getting a plasmapheresis, can you please message me down on the comments or send an inbox and let me know. I just make my day. So I love you all, and I better go. I have my family. I don't want to keep them waiting. Bye.